Hello everyone, I'll be presenting on a non-invasive biomarker of microbubble distribution in the brain, comparing intraoperative CEUS with DSC perfusion MRI. As many know, CEUS is a surgical technique utilized for brain surgery that allows a real-time qualitative non-destructive imaging. In 2021, Prada performed a quantitative analysis of intraoperative CEUS and provided information regarding the distribution of microbubbles in different lesions and anatomical structures. In the last decade, the outcome of BBB opening has been massively studied. Many parameters, such as the microbubble size, the molecular composition, and the administered dose, have been reported to be directly correlated with the outcome of BBB opening. In addition, recently Song postulated that the total gas volume may be used as a unifying parameter for CEUS treatment. Since microbubbles are a pure intravascular agent, we hypothesized that the microbubble distribution is correlated with the parameters obtained with DSC MRI maps, which are an indicator of the microvascular cerebral dynamic, in order to validate DSC as a non-invasive biomarker to predict the distribution of microbubble. We enrolled 29 patients with different brain tumors. The patients were divided into two groups. The first 10 patients received a qualitative evaluation between a volumetric DSC and intraoperative CEUS, while the remaining 19 patients received a quantitative evaluation. However, 6 cases were excluded due to severe motion artifacts or the presence of defects during MRI acquisition and during the processing of the data. We performed an MRI acquisition within 2 weeks before surgery. Then during surgery, after the craniotomy, it was performed an intraoperative egress imaging with an ultrasound machine integrated with a magnetic tracking system, which allowed to virtually navigate the maps. And a CEUS acquisition was then performed with a bolus of microbubbles. Fusion imaging, the fusion imaging system had a positional discrepancy of less than 4 millimeters. We observed a superimposable signal intensity regarding the distribution of microbubbles and gadolinium in anatomical key structures. This is an example of glioblastoma. As you can see, the CEUS image is displayed on the left of the screen and is coupled with the coplanar CBV DSC map on the right side. The two imaging modalities are linked together, and the MRI follow the real-time CEUS navigation. As you can see from a qualitative standpoint, the microbubble distribution follow the distribution of gadolinium on the DSC MRI. This is another example of another GPM, and also here you can see a superimposable correlation of the distribution between the two modalities. This is the same image, but colored with the red is the most perfused region of the brain and is correlated with the CEUS, the distribution of microbubble in the CEUS. After the qualitative evaluation, we performed quantitative analysis of the other remaining patients using 2 different softwares. We draw some circular region of interest on key structures, in particular the artery, the lesion, the white matter, and the gray matter. For each ROI, the software provided the tick, which is the time intensity curve, and with the tick we obtain quantitative metrics that were analyzed. The results from the quantitative analysis were the following. We analyzed the ROIs The results from the quantitative analysis were the following. We observed a linear correlation between the normalized CBV, cerebral blood volume, with the normalized AUC, area under the curve, obtained from CEUS. As you can see, we observed a person of 0.80 with a p-value of significance. However, if we observed the time to peak parameters, we were not able to identify a significance correlation between the time to peak of the DSC and the time to peak of the CEUS. In conclusion, the possibility to predict the distribution of the microbubbles in the human brain is of great importance to improve CEUS treatments. In our opinion, CBV maps obtained from the DSC are a valid non-invasive biomarker to predict the distribution of microbubbles, both in lesion and in anatomical structures. So we think that DSC may in the future be used as a safe and fast MRI sequence to optimize planning for emerging CEUS treatment, in particular for tailoring the treated area. Thank you very much.